Hi, good evening everyone. I hope I am audible to all of you. Can you please give me a quick thumbs up if I am audible? Just waiting for confirmation whether the audio and video is fine so that we can start this session. Right. So today I will be taking this session which is very close to my heart, and that is how to prepare for an exam when you have an year or slightly more than that for your preparation, right? Obviously at this stage there must be a lot of anxiety that will be there in students mind about the upcoming exams that are there. There is NEET PG 2025 exam that is still pending. There is May INI-CT exam that is still pending. This is a common question that can come to your mind, that why I'm not speaking about those exams. So I have spoken a lot about those exams, and I believe that all those students who are targeting these exams are already into their revision mode. And let me be very honest to you that this cannot be a right time to start for the NEET PG 2025 exam. But if you are just finished your internship and you are clueless that what I should do so that I can get the dream rank that I am looking in the NEET PG 2026, probably you are at the right place, right? So this is the whole idea about this particular session. So there are few questions that I'm gonna address. These are: I want to start studying for the NEET PG but do not know how and where to start. Do I cover my fundamental through textbook? Do I just do previous year topics or previous year question? When should I ideally complete my first read before revision? And how do I develop a habit of solving MCQs? Everyone says that I should make my own notes. How do I start making them, and how do I revise effectively, right? These are the questions that I will be addressing into this. If you have any other question apart from this, please write it in the comment section. I will be waiting for some time so that you can put your question in the comment section. Hi Anand, I have seen your question, bache. We have made pre-made NEET PG flashcard based on, please consider. Okay, all right, so do reach out to me separately on this, dear, right? Okay, so if you have any other question apart from this, please let me know and I'm gonna try to answer it, right? But before I go forward, I just want to tell you that everybody has a different level of learning during MBBS, right? Some of us have prepared very well. Some of us have read the textbooks extremely well. Some of us have attended some foundation courses and have created our notes already, but majority of us are starting now. And when you are starting now, a lot of time these kind of thoughts are coming to our mind, that I have not studied so well. Am I really eligible to crack the exam? Answer is yes. A lot of students have done it in the past, so you are also eligible to crack the exam. All that is needed to crack the exam, if you ask me absolutely honestly, I will say is a 10 to 11 months of dedicated studies, right? If you are able to focus for 10 to 11 months for a dedicated study, I am telling you there is a very high chance that you will be able to crack the exam without much of an issue, right? But what are the things that are needed to crack the exam, if you ask me, right? So this is an extempore session that I am taking it. I have not prepared any slide for it. I am gonna tell you on the basis of my 2 decades of experience of teaching and changing life of so many students that I don't have a number, plus my own experience when I prepared for a PG entrance exam, right? So if you ask me that what is actually needed to crack an exam, I will say that these are the following ingredients to crack the exam. The first ingredient is complete reading of all 19 subjects, right? That means you are not allowed to skip any subject, right? A lot of time we try to take shortcuts. We are not supposed to take shortcuts. So what is the biggest cut? The biggest way is read textbooks, right? But as I told you that should have been done during the MBBS. Now in internship or post internship, if you have 1 year, you need to complete all 19 subjects. And let me tell you this, the time that you should take to complete these subjects should be around 6 to 6.5 months, not less than that, not more than that. So this is the ideal time that you should spend. Okay, now the question is, sir, why this much time? Why not less than that? It is because if you're gonna take time less than this, there is a high possibility that you will be compromising onto the topics which are commonly asked in the exam, right? If you're gonna take more than this, then probably you will be missing your time onto revision, right? After this, you need around 3 sets of revision, right? This is the standard philosophy, right? So this is the content that you have to do. Now along with this content, what is the other thing that you need is practice questions. Okay, a practice question. Now what kind of question that you need to practice? The first thing that you need to practice is previous year questions, right? Now why do you need to practice previous year questions? You need to practice them because it tells you the thought process of the examiner. It tells you that how the examiner is going to ask you this particular question in the paper. This will tell you that if a question on pulmonary embolism will be asked, how the examiner is going to structure. It will also tell you that what topic are more likely to be asked in the exam, what topic is less likely to be asked in the exam. Imagine you are doing last 5 year questions and you know that every year a question on aortic dissection has been asked, right? In the 5 year, twice this question has been asked. So the probability of this topic being asked again further increases, right? Now you know that in last 7-10 years, there is a topic that has never been asked, right? The chances of that topic being asked in the exam comes lower in the priority list, right? So this is a very simple philosophy that you have to do. But what most of us are unable to understand is we feel, okay, I have done the PYQ, that means my job of doing the questions is done. No, that is not. The previous year question tells you that these are the topics which are important. But now, will the same question be repeated in the future? Answer is no. So, by reading PYQ, what will come? We will get PYT. That means previous year topic. And once I know previous year topic, what I'm gonna do? I will read it in depth, right? I will read it in depth. So this is the very simple philosophy, right? So now you have done the theory, you have done the previous year questions, you have identified the previous year topic, and you have read those topics in depth. What next? What we are supposed to do? Now, let's say you have started your preparation in March, or let's say you have started in April, right? Earlier you start, the better it is because you're gonna get more time. The biggest query that you get at this stage, lot of people ask me, ki, sir, shall I prepare for NEET PG 2025 right now? Because I am not sure. There could be a chance that the exam is in June, there could be in the July. So I have 4 months. I will prepare very hard in these 4 months and will be able to crack it. I say, this is, I on a personal level will discourage it. Do you know why? Now I'm going to discourage it because if I say that you have never prepared for the exam, the chances of you competing with the people who are preparing so very well and getting to the highest of your potential is extremely unlikely. And aim of any competitive exam is very simple, and that is you should be able to reach to the highest of your potential. And once you are able to reach to the highest of your potential, then the rank does not matter. But it is always you should be able to reach to the highest of your potential. And your potential could be 100. Your potential could be to get a rank in top 10, or could be to get a rank in top 500. Now, I got an opportunity today to go to VMMC, Vardhaman Mahavir Medical College and Safdarjung Hospital, where the Olympian Mr. Abhinav Bindra was on a panel discussion, and there were a lot of eminent orthopedicians who were also there on a panel discussion. It was related to sports injury, and there is a very interesting thing that has come out, which the director of the sports injury said, that when do you think that you are most prone for injury in the sports? And he said that, and it was with the coaches, and he said that the main aim of the coach is to identify the true potential of the player and to help him in reaching to that particular potential. Most of the injuries happen when they are in a fatigue stage and when they overstretch themselves, right? That is how. So now, can we increase the potential? Definitely we can increase the potential, but can I increase it in one day? No. So I am supposed to learn it in a way so that I am slowly increasing my potential and finally reaching to my highest potential. And for that, you need a minimum time. You need a minimum time, and the minimum time that you need is around 10 to 12 months, right? So that is what I recommend, right? So what I will suggest is that, let us say that you have started in March, you have started in April. So what will happen? You will cover 4 subjects in the 1 month. You're gonna cover 4 subjects in the second month. The extremely important part that we have to learn to add it in our preparation at the beginning of our preparation is add 1 GT per month. Add 1 GT per month into this particular preparation, right? Now, do you know what it will happen? Now, the biggest challenge that you're gonna face is, sir, I am just starting. How can I add a GT? I say, do a GT of all 19 subject, but divide them into 2 group, 4 plus 15, right? Now, these 15 are the subject that you have never prepared for a PG entrance exam, but have studied during your MBBS. And these 4 you have read for your PG entrance exam, right? And this will give you your baseline score. Now, in the month of April, now you have not covered 4 subjects. You have covered 8 subjects, 4 plus 4. And now the GT that you're going to write will tell you 8 plus 11. Are you getting it? So now, previously you have prepared only 4 subjects. Now you have prepared 8 subjects. So your GT score should follow an upward trend, right? Now this will tell you how many extra questions you are able to solve from these 4 subjects, plus how much you are able to retain from the first 4 subjects. And then the month of May will come. And in month of the May, you will have 4 more subjects. And you'll have 4 more subjects, and you're going to do GT. This will be 12 plus 7. So every month you are having 4 extra subjects that you are covering, or 3 extra subjects that you are covering, and your GT should follow an upward trend, right? Now this is an upward trend that your GT should follow. Now slowly and slowly you will realize that you are progressing it, right? The key is consistency. The extremely important key for this is consistency. Any student who remained disciplined and consistent will finally be able to reach to their highest potential. Will you get the result in 10 days, 15 days, 1 month, 2 months, 3 months? No. It will be a consistent effort of 10, 11, 12 months that is gonna give you the desired result which we all are looking at, right? Now, a lot of students can have this consistency on their own. For a lot of time, you need a support to have a consistency, right? And this is an area where this year DBMCI has done a major transition in their courses, specifically to provide them the best possible environment that is available. And we are bringing DBMCI live 360-degree programs. Now, these DBMCI live 360-degree programs are exclusively designed for the students to give them a disciplined environment so that they can maintain consistency without the worry of what is to be read and from where what is to be read with the best place, right? So what you will be doing is you will be reading all 19 subjects with the expert faculties of DBMCI live on DBMCI 1, right? DBMCI live classes on DBMCI 1, and these classes will be for 6 months. And there is a very, very unique thing that has been done in these courses, that every student has a different date of internship end. So a lot of time we feel that how our batch will remain live. So every month the course has been designed in a way that at whatever day you gonna end, you gonna start, you gonna be finishing in 6 to 6.5 month your course with all 19 live subjects. For example, if you're starting in March, your course will be March, April, May, June, July, August. And by August or first week of September, your subject will over. If you're starting in April, then the course is gonna be till September. If you're starting, this is finishing late and you're starting in May, it will be in October. And in the 6 months, you will be able to complete all your 19 subjects in the perfect way, right? But as I have told you that the course completion is just one thing. Every day you will be given a custom module. You will be given a custom module, and this custom module will be designed by the teacher, by the questions selected by the faculty for you, so that you can practice that how much have you learned, how the questions are being structured in the exam, and how much have you learned from that particular day. So you will be practicing these questions exclusively created for you on the basis of the topics that have been covered on that particular day, right? Plus, you will have an option of instant doubt resolution. Now, this is a unique opportunity for you to ask your doubt there and then, right? You know that this is a live class that is going on. This is a doubt resolution. You can ask the faculty this doubt and that will be solved there and then, right? Plus, you will be getting uh, an opportunity to write your notes yourself, right? Um, there is an addition that we are adding, the uh, guided handwritten notes. We will also try to give it to you. You will be getting workbooks for that, right? Now, these will be digital workbooks which will be available. There will be an option of having a hard copy of that also. If you want a hard copy, you can get a hard copy. If you are comfortable in writing your digital notes, the digital workbooks will be provided to you, right? Plus, you will be having after this an opportunity to get your customized course. You will be having an option of T&D discussion also, to understand that how much you are able to recall. That will also help you in remaining on track. And this T&D is gonna last not for the 6 months now. This is for 3 to 4 months, right? Now you want to do very, very quick revision, you can split it into two. You want to do slow study revision but at a length, then you can follow the exact T&D schedule, right? Plus, after this T&D, you will be having an access of one shot revision also, right? One shot. So that is how this is gonna be structured. 6 months, 4 months, 15 days, right? So at every stage you will be hand holded by the teachers, by me, that how your day has to be structured, how your course has to be completed, what are the challenges that you will be facing in this, right? My biggest advice to you is that this is what you have to follow. You have just finished, you have a doubt. Now let's come back to your question. So you have a doubt, but this is what you have to follow. Now this is gonna solve all your problems that you have. The first problem that you have is, now let us see. I want to study from NEET PG but do not know how and where to start. I have already told you that you have to make sure that all the 19 subjects that you are reading, identify your discipline level, that what kind of discipline level that you have, but please Do not skip any subject. Do I cover my fundamental through textbooks? In 1 year of preparation, it is usually not possible to cover the fundamental through the textbooks. Lot of teachers are there and they can make the content a lot more simplified for you. A lot of time you can select the teacher at your end. You want to give us a chance, definitely give us a chance, and I can assure you that we will not disappoint you in making the content simplified for you, not just for the radiology but for all the subjects. Do I just do PY2, PYTs and PYQ? Answer is a big no. If you really want to reach to the highest potential, this is important to do, but not the only thing that you're supposed to do. There are many more things that you have to read. PYTs helps you in solving a lot of questions in the paper, but it doesn't help you in solving the rank differentiating questions. That can only be solved once you have a sound knowledge of the subject, right? Now, when should I ideally complete my first read before starting revision? As I told you that you should take 6 to 6.5 months to complete your first revision, to complete your first reading. If you are starting late, the first reading should be completed ideally 4 months before the exam. Ideally 4 months before the exam. That is the time of finishing the first reading. If it's 3.5 months, I will still say okay. If it is less than that, then we are missing the bus, right? How do I develop of a habit of solving MCQ? Yes, solving questions daily on the topics that you have done. Do you know why? Because you want to create a positive cycle. Now, what is a positive cycle? You do some work, you fail in that work, you don't feel like doing the work, right? This is a very, very simple human psychology. You have done some work, you have gained some success, it motivates you to do the work again. Now, once you work again, you get more success, which motivates you further to do the work again, right? So all the students who do not develop the habit of solving MCQ is because of the bad experiences in the past. So what we have to do, every day we have to read a topic, and then first thing that we should do is we have to learn solving question from that particular topic. The chances that I am able to solve that question is high. And if you are able to solve some more tricky questions, it will give you a positive addiction that I want to solve more, and slowly this addiction will become better. We have incorporated this in this year, where, as I told you, every day exclusively made uh, questions will be given to you, and from your favorite Q bank, which is Marrow Q bank, right? Everyone says I should make my own notes. If you ask me, sir, own notes, handwritten notes, or uh, pre pre-made notes, the best way is to make your own notes, without a doubt. Why? Because the once you write it yourself, there is a much higher chance that your brain will be able to recognize it far better. Pattern recognition is far better, right? But a lot of time some people are not very savvy. Sometimes people are unable to concentrate when they are writing it. Then those students can definitely go with the pre-made notes or the pre-written notes, right? But ideally you should make the notes as you are attending the classes, right? You should not procrastinate, you should not delay it too much, and you should do it there and then, right? Now, how should I revise effectively? Now, I always believe on this philosophy that revision means revisit, right? What will you revisit? Any place that you have visited before. So a revision cannot be before the first reading. A lot of time people say, sir, I have started, how will I revise? I say, first you have to start, right? How will you win the race? In order to win the race, you have to start, right? So first you have to do first reading, right? And then you will revise it, right? Now once you're revising it, you are revising it from your main notes only. You are underlining the areas that you are forgetting, and you are focusing more on them, right? The revision should be based on test, and that is an area where the introduction of test and discussion is gonna add a big boon to you, right? Ideally, you should have solved the Q bank in the first reading. But because of whatever reason, if you are unable to solve it, then in the first revision, which you are doing it with the TND, you can solve the Q bank. You can see that what are the areas that you are forgetting and back it up with a test that you have, right? So this is the answer of all the questions that you have asked me. Now, let us see what are the questions that you have given here. How to manage live classes and internship and duty simultaneously? Chinmay, very, very important question. And a lot of students, particularly in North, they try to crack the exam along with the internship. Is it possible? Answer is definitely I did it. I cracked the exam during my internship and with rank 1. So it is definitely possible. Did I study very, very well during my MBBS? I will say I studied, but very, very well, that I'm not really sure, right? For some subjects, I have read textbook. For some subject, I have used shortcuts, right? But in internship, sometime it is very, very hectic. So that is another boon, the live classes. The live classes, uh, recording is also gonna be there, right? So what, because of whatever reason you have an internship and you feel that you are unable to do that, try not to delay it too much. As soon as possible you get a time, try to complete that particular topic. I realized it and I keep on saying this to the students, that you are young, right? If you're preparing for the exam, the average age that you will be having will be between 22 to 27, 28. That's broadly the age, with few exceptions left and right, right? So this is an age where you are most active in your life, right? This is the age. So one thing that you can compromise slightly is your sleep. Now don't compromise it too much. Try to sleep for 6.5 hours, right? If you think that the internship was slightly hectic, try to cut down half an hour, 1 hour from your sleep and utilize it, not to watch a movie on a Netflix, but to watch a movie by me as an actor, by Dr. Thamim as an actor, by Dr. Jay as an actor, and watch a movie of surgery, watch a movie of medicine, right? That is what you can do. Diksha, what is your question? All I can see is answer my question. It can help. Yeah. So an apple will remain an apple in a university exam also, as well as in a NEET PG exam. So there is a lot of overlap of the topics that have been asked, but I just want to clarify that these programs have been specifically designed with only one motive, and that is how the student can get the best possible rank in the NEET PG exam, right? So this is the you should know the target. When I was preparing, or when I was doing MBBS, very, very early in my life, I realized that nobody will ask me how many marks I have got in pharmacology. But the moment I will tell this to anybody that I am a doctor, the first question that I will be asked is, from which specialty, right? So that's an unfortunate truth. So that is the reason that I have always focused about learning the subject well, that how good I am as a doctor, and thinking that how it can help me in cracking a PG entrance exam. These were the only two philosophies which I have read. So will it help you to pass the exam? Definitely yes. Do you think that I will be able to cover each and every topic that is being asked in the university exam? I'm not really 100% sure. And as far as my subject is concerned, that's not a university subject, but it can definitely help you in passing the exam, right? But for a NEET PG, it will definitely help you to reach to the highest of your potential. So currently I have 1 month study holidays. In April, I have final university exam, and probably in the month of May, my internship will start. How should I think? Diksha, I have already spoken about it, Bachi, right? Okay. How do I connect to you separately regarding? Bachi, drop me a message on Insta. My ID is Doc Rajat Jain. So you search me on the Insta and drop me a message there, right? Okay. All right. So that's all. These are the small. Okay. Sometime what you can do is that if you think that you have some more free time, cover more subjects during those time. When you have less time, then try to do the revision. So all of these things can be done. I can tell you that any student who follow the philosophy of first reading, thorough reading, plus solving questions, which include previous year questions, plus GT, plus revision in the form of solving QBank, revising main notes, plus test and discussion to assess themselves, plus one shot. And if all these are plus, the answer is a winner. That's all. Right? That's all is a very simple philosophy to crack the NEET PG 2026 exam. If you can do it yourself, if you can maintain that discipline yourself, very good. Do let us know what we can do. If you think that you need our support, do explore DBMCI live 360-degree plan. Now for the convenience, we have added, because nowadays you do not know when the exam is gonna happen, right? So now for your convenience, we have added lot of flexible plans for you. You can have a 9-month plan, you can have a 12-month plan, you can have a 15-month plan. My suggestion, if you're starting now, is to go for a 15-month plan, because usually the exam that we expect will be somewhere in May or June. INI-CT exam will definitely be in the May, so you are very well covered up to that particular point. But if you want a shorter version, you want to prepare only till November INI-CT, you can go for a 9-month plan, or you can go with a conventional 12-month plan. Do let us know that if we can help you out in any way. But with this, I want to welcome you to the gold standard in guided learning, which is DBMCI, right? That's all from my side, guys. Thank you very much for your time, and uh, do let me know that if we can do anything else for you, right? Take care, and may God bless you all.